Continuing with Chapter 3, Objective 3, now we're going to define, pronounce, and spell terms used to describe the anatomic planes. So anatomic planes are imaginary flat fields used as points of reference to identify or view the location of organs and anatomic structures. Anatomic planes are frequently used in diagnostic imaging and surgery. The body is assumed to be in the anatomic position unless otherwise specified. So let's go ahead and learn our anatomic planes. We actually have two planes that actually mean the same thing. Frontal or coronal, which is a vertical plane passing through the body from side to side, dividing the body into anterior and posterior portions. And you can look at table 3.2. They have that imaginary line going through that figure. Then we have mid-sagittal, vertical plane passing through the body from front to back at the midline, dividing the body equally into right and left halves. Parasagittal, vertical plane passing through the body from front to back, dividing the body into unequal left and right sides. Sagittal, vertical plane passing through the body from front to back, dividing the body into right and left sides, any plane parallel to the mid-sagittal plane. And then transverse. This is the only horizontal plane dividing the body into superior and inferior portions. So here is an MRI that is taken from using different planes. The front one is a frontal or coronal diagnostic MRI. The second one is a mid-sagittal MRI, and the third picture is a transverse MRI. And then this is a the same figure 3.6 that is in your book. So this is a easy visual way to understand what the different planes represent. Let's go ahead and continue with body position. So Objective 4, define, pronounce, and spell terms used to describe body positions. The first one, Fowler position, semi-sitting position with slight elevation of the knees. Lateral recumbent position, lying on side, right and left precede the term to indicate the patient's side. Lithotomy position, lying on back with legs raised and feet in stirrups, hips and knees flexed, thighs abducted, which is away from the body, and externally rotated. Orthopnea position, sitting upright in a chair or in bed supported by pillows behind the back. Sometimes the patient tilts forward, resting on a pillow supported by an overbed table. Prone position, lying on the abdomen facing downward, head may be turned to one side. Recumbent position, laying down in any position. Sims position, lying on side in a semi-prone position with the knee drawn up toward the chest and the arm drawn behind parallel to the back. Supine position, lying on back facing upward. And then we have the Trendelenburg position, lying on back with body tilted so that the head is lower than the feet. So the book has some really good diagrams so you can visualize what they're trying to tell you. Here is an orthopnea position. Again, they're sitting, actually they're being tilted forward, resting on a pillow supported by an overbed table. So they're showing you that in the ribs there is an area for needle insertion. So they're saying this position is necessary to perform thoracentesis, a surgical puncture to aspirate fluid from the chest cavity, which we'll learn about in Chapter 5. Then we have types of recumbent positions, the supine, prone, left lateral, and right lateral. The first one is the Fowler position. So semi-sitting position with slight elevation of the knees, which you really can't see that. And then the Trendelenburg position, lying on back with body tilted so that the head is lower than the feet. Now, some of these body positions are capital. Fowler, Sims, and Trendelenburg. So these are eponyms. They were named after the surgeon who developed the position necessary for the specific procedure. So they're named after the surgeon. They are eponyms, so they have to be capitalized. At least the last name needs to be capitalized. And here they're just asking what could these body positions also be called. And again, when we were reading the definitions, I did not go into the also known as terms, but again, they're in your book within the definitions at the very end of the definition in bold. So these are the other names that they could be called.